Hello everyone, I would like to share with you today a case that was treated in our clinic. This patient has a severe atrophy in both jaws, maxilla and mandibula. As you can see here in the maxilla, the bone are located between the red lines that I'm gonna draw now. So between the red lines that I'm drawing now, in these cases where the bone is located in this area and in the pterygoid area, we insert 8 implants. 2 implants are located in the pterygoid area, in this area of bone. And this one too. And 6 are inserted in the anterior area of the maxilla. I will show you the final result in the next slide. So we have done, as I explained in the last slide, 2 pterygoid implants, 6 compressive 2-piece implants in the anterior area of the maxilla, same implants we used in the mandibula, compressive 2-piece implants, in this area where we have a little bit of bone and especially a cortical bone. As you can see now, we removed her removal dentures. We start the anesthetics. Then we extracted all her anterior teeth. As you can see, we opened the flap until we reached the bone, her bone in the anterior area. And then we start to insert 6 compressive 2-piece implants. As you can see here. Again, it's the second implant. And now is the final implant, the 6th implant, compressive 2-piece. Now we suture it up. And we will start with the pterygoid implant right now. The pterygoid implant has fixed rules and a fixed procedure. We must open a flap to do a pterygoid implant. We must expose the end of the maxilla in both sides, move away 3 millimeters from the end of the maxilla and insert an angle of 45 degrees toward the throat. I will show you right now how we do it. Now we are opening a flap until we reach the bone, the end of the maxilla. We move away 3 millimeters and we insert it in an angle of 45 degrees. As you can all see, we have done the first pterygoid implant, the same procedure from the other side. We open a flap We expose the bone. We move 3 millimeters from the end of the maxilla, angle of 45 degrees toward the throat. We start our implantology. We insert the implant. Then we fix the healing cup up on the implant. And we suture it up again. Now we're gonna start with the lower jaw. As I explained to you before, we extracted all her lower teeth and insert 6 compressive 2-piece implants. As you can see, we extracted the teeth. We open a flap. We must open a flap to see the bone in the lower jaw. We remove the alveolar bone until we reach the healthy bone in the lower jaw. We clean up the sockets too, and we start our implant insertion. Here is the first compressive basal 2-piece implant. We insert the last implant. The healing cup upon implants, as you can see. And we suture it up. This is the result after 3 weeks. Here is the healing, wound healing of the gum. And now we will fix her prosthetics after we took an impression. It's a screw prosthetics, as you can see in the lower jaw. It's very accurate. That's his restoration in the lower jaw, fixed restoration. And now in the upper jaw, here are the implants we have done in the upper jaw. We fixed her restoration. Again, it's very accurate. We needed a little bit of balance at the end. And this is the ideal result. Even with severe atrophy, as you saw before, we can still avoid for patients a fixed restoration without sinus left and bone graft. Thank you very much for watching.